Hi, my name is Bonzo Reddick, born and raised in Savannah, Georgia, right here. I'm a physician, I'm a family medicine physician at J.C. Lewis Primary Healthcare Center, and I have a primary care practice here with a little bit of a focus on women's health as well. Absolutely, I did. I got it the first week that it came out, so I was in a rush to get it, ready for this pandemic to be over. Well, a lot of you all probably noticed just from the past year, like we've been doing the social distancing and wearing masks, and through that whole period, the cases were just going up, 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 up. And ever since the vaccine came out, all of a sudden the cases are starting to drop. So it seems like out of everything that we've done so far, all the research has been done on COVID, the thing that's the most effective in decreasing incidence of COVID, decreasing the cases, decreasing deaths, has been the vaccine. So that's why it's just been critical. Just to give you some examples, we've been doing this phased rollout across most of the country where we're initially giving it to the most elderly patients, the patients at highest risk, people in long-term care facilities like nursing homes. And those are the groups that we've seen those cases drop significantly. I was just reading a report from the Medicare Center for Medicare Services data and some of the data from the COVID task force. And it turns out that since the middle of December when the COVID vaccine started, just from that moment to now, nursing home COVID cases have dropped by 89%. That's almost 90%. That's just amazing. And just in terms of sticking with the elderly, nursing home ER visits, emergency room visits, since the vaccine was started, since the rollout started, have dropped by 70% in elderly populations. So you're talking about nursing home COVID cases down 89%, emergency room visits down 70%. That's pretty dramatic, and there's nothing else that we do besides the vaccines that have caused that kind of a response. So sorry that was a little long-winded, but the point is the vaccines are the biggest thing we can do to help hopefully get this pandemic over soon. So everything has side effects. One thing I always kind of say half jokingly but half serious is that anything that we have can have a weird reaction, an unknown reaction in anybody. Unfortunately, there's people who die every year from eating peanuts, but in general, most people can eat peanuts and they'll be just fine. So the vaccine is the same way. There's always a possibility that somebody could have a reaction, but that's very, very rare, just possible. The main side effects that are more common or more likely to happen are just the typical side effects that happen with any vaccine. You might get a little bit of pain at the site of the injection. Most people get in their non-dominant arm. So for me, my left arm was sore for about a day. Some people do get some symptoms as their body is forming that immune response. So the point of the vaccine is for your body to learn how to fight COVID. And so when your body's creating the antibodies and creating the response that's going to help you remember how to fight COVID, your body sometimes will have some symptoms for about 24 hours. So that's maybe some low-grade fevers, maybe feeling a little bit of muscle aches, a little bit of pain in the neck or kind of a little mild headache. Those things can happen sometimes. But again, they're pretty manageable and they're almost always gone within 24 hours. So if I could answer that in two ways. Number one is if you're asking, will you get COVID from the vaccine? The answer is no. So even when you have what we call live viruses, those don't give you the disease either, especially if you have a normal immune system. But this is not a live vaccine. This is a vaccine that's helping your body recognize a specific protein. They call it the spike protein that's on COVID. So you can't catch COVID from this, essentially this piece of the vaccine that your body's using to recognize it. The example I give people with that is imagine if if bad guys always dress a certain way. And so we show we're showing law enforcement people like, hey, this is a way somebody dresses. This is if you're looking at using an army cliche or analogy, this is what the enemy uniform it looks like. So you bring the uniform in and show them. That uniform itself can't kill you, right? It needs to be a bad person in the uniform to kill you. So that's kind of what we're doing in terms of that's the way somebody explained to me when I was in school about how the vaccine works. It's like you're showing the clothes of COVID, but not the actual COVID itself. And so the vaccine itself cannot give you COVID. Now the second part of that is, can you get COVID if you've gotten the vaccine? The answer is you can still get it. It's not 100% effective. The two most common vaccines that people have talked about, the Pfizer and the Moderna vaccine, those are about 95% effective. So that means there's still a 5% chance you could get COVID if you get the vaccine. But here's the good news though. It turns out that even though the COVID incidence is still there, is still a possibility, you could still catch COVID. Catching severe COVID is it's really, really unlikely. So the vaccine won't be 100% making sure you never ever get COVID, but it means you have almost no chance of either dying or being hospitalized with COVID. So the short answer of all that, that long-winded answer is that what will the COVID vaccine do for you? It'll make it very, very, very unlikely that you will ever die or get very, very sick from COVID. Yeah, so that's a good question. So one of the things that people ask me about all the time is they always say, I don't want that warp speed vaccine. I've heard that a whole bunch of times. So in this country, we called our vaccine rollout process Operation Warp Speed. And so people thought that meant that the vaccine was developed in warp speed. That's actually not what we mean by that. What we're saying is the actual delivery of the vaccine, the goal was to do it at warp speed. So for example, the initial goal was to try to do 100 million vaccines in the first 100 days of 2021. And we've actually surpassed, I think we surpassed that in about 60 days actually. So that's the warp speed part of it. The actual vaccine itself has actually been in the works for a while. If you look at the company Moderna, that's one of the makers of one of the vaccines that are available. That company's been around since like 2010. They've been studying RNA vaccines for almost 10 years. And a lot of the technology that they're using is based on stuff that's been around for about 12 years. So for those of y'all who remember SARS, the original SARS outbreak that happened many years ago, or the MERS, the Middle Eastern Respiratory Syndrome virus that happened, that was in Saudi Arabia outbreak for a while, that was actually when people started studying this kind of technology. So the technology was there. This is just the first time it's really been implemented on a wide scale. So even though it feels like it was fast, it was really technology that's been in the works for a while. In addition to that, the other people say, well, it still seemed like it was really fast. It was like less than a year and we got this vaccine out. Well, the reason why is because everybody wants life to get back to normal. There were extraordinary resources put into this one that's not put in the other people. A lot of it was funded by public, by governments. So unlike a private company who normally makes a vaccine and has to go through all these different processes and financial steps, they were able to skip through some of those steps. They didn't skip through any of the steps of the actual science, the actual vaccine development, but they were able to skip through some of the paperwork. I was speaking to people in the Department of Public Health, and they were saying a lot of times you would put in an application for something or you turn in paperwork for a vaccine, and it would sit on somebody's desk for a few weeks, and it would go to this organization and sit for a few weeks. But because of the urgency of COVID, that didn't happen. So a lot of that happened fast in that warp speed. But as far as the science and the rigorous methods we go through to make sure the vaccine works and is safe, that was not warp speed. That was done at the same pace it is always done. That's a great question. So I mentioned kind of my practice here at JC Lewis and in my medical practice, but sort of the other half of my professional life, I'm also in the field of public health. And so I actually went to grad school for a degree in public health, and my focus was on what we call health disparities. So that's looking at the unequal treatment of different populations. And I kind of personally and professionally have had an interest in racial and ethnic disparities and looking at things like that, like the mistreatment of people, black and brown people in our healthcare system in the United States. And so I know about the history you're talking about. I've talked to our medical students about it before. And but one thing that's happened is things have changed a lot that makes some of those things, there's a lot more safeguards in place, I guess is the best way to say it. So if you think about Tuskegee, we did not have a very diverse physician workforce at the time. Same thing with nursing workforce as well. There was not a lot of oversight, so people were allowed to get away with a lot of the things that you're talking about. But now we have a whole lot more oversight. We have a much more diverse workforce. We have a lot more people looking at these things. When people have studies, there's these things called IRBs that are required for any time you do a study. So there's an oversight board that looks at this. And so there's just a lot more eyes on things and make that a lot less likely to happen right now. Not saying it's completely impossible, but at the scale that COVID went out, it's impossible. I mean, you think about if there was something kind of, I know one thing people have brought up, like, is this some kind of gimmick to make black people sick or something like that, like in Tuskegee? Again, if you look at the past things that have happened in our history, they were typically all one people in one group in a study. So for example, the Tuskegee experiment were pretty much all black sharecroppers in Alabama. They were all men. If you look at some of the studies, like I forget the exact name of it, but the study that was done, the unethical study of Jewish children, where they were injected with pathogens to see kind of what would happen, that was only Jewish children. There's been studies of people in prisons that was only prisoners. Whenever you see something that's being studied where everybody's getting it, you know that's not the case. And just one little quick comment along those same lines is one of my friends pointed this out to me. They said, if this was something that was harmful to black people, you would not have people from all walks of life clamoring to try and get these vaccines. There was a case in California where people they were actually trying to target some of the really hardest hit communities. So and a lot of people, you all are probably familiar that black people are dying disproportionately from COVID. So they were actually trying to target black communities for the rollout of the vaccine. And there were people that were stealing the numbers, the ID numbers, to be able to get the vaccines to go into black communities and get it. If this was a big conspiracy to make black people wipe us out, that would not be happening.
Well, thank you so much for being able to give us this good information and your expertise on the COVID vaccine. J.C. Lewis has been working diligently on trying to get our community vaccinated. We have teams working in the clinic, teams out in the community, just trying to make sure anyone who wants the vaccine under certain guidelines are able to get the vaccine. If anyone is interested in getting the vaccine, they can always visit our website, www.jclewishealth.org, or they can call our clinic at area code 912-495-8887. Again, we appreciate you, Dr. Reddick, for taking time to educate those who are uninformed about the vaccine, and we
Thank you so much for having me, and thanks for everything we're doing to stomp out this virus and get this vaccine out there. So thank you.